Have you ever felt it? That absolutely terrifying moment when your heart starts pounding, you can't seem to catch your breath, and you're just certain you're dying? But what if it's not a heart attack? What if it's more like a system malfunction, a kind of biological false alarm? Well, today, we're going to dive in and decode what's really going on with something called panic disorder. So let's just start with a number, 31%. Now, get this. In medical settings, almost a third of all cases where people come in with heart palpitations, well, they aren't actually caused by a heart condition at all. They're linked to psychiatric conditions, and panic disorder is a huge one. This is exactly why it's such a critical topic to understand. Honestly, this is the best way to think about it. Imagine your body has this amazing built-in emergency alert system, right? It's designed to save you from a real threat, like a predator or, I don't know, a falling piano. A panic attack is what happens when that system just goes off for no reason. It's not a sign that you're in danger. It's a sign that the alarm itself is on the fritz. And this false alarm, man, it is an incredible actor. It masquerades so perfectly as a life-or-death medical event that it sends thousands and thousands of people to the emergency room every single year, completely convinced their life is hanging by a thread.
And let's be super clear here. This is not an overreaction. Not at all. The physical feelings are intensely, terrifyingly real. Your heart feels like it's going to hammer its way out of your chest. You can't get enough air. You might get dizzy, shaky. The whole experience is so visceral, so frightening, that running to the ER is the most logical response in the world.
So, to really get why this happens, we need to look at what's going on under the hood, clinically speaking. What actually separates this from, say, a normal stress response? Let's break down the anatomy of what a panic attack actually is. So, what makes this a disorder? Well, medically speaking, it's all about these sudden, intense waves of fear that happen more than once, and the real keyword here is unexpected. They feel like they come completely out of the blue with no obvious trigger, and that's exactly why they're so incredibly disorienting. Now, for a doctor to officially diagnose this, they don't just guess. They use a very specific checklist. See, this isn't just about feeling anxious. This is a full-body event. To meet the criteria, a person has to have at least 4 different physical or mental symptoms from a list of 13, all happening during one of these attacks. So let's take a look at what those are.
So the symptoms really have 2 different faces. On one side, you've got all the intense physical stuff we've been talking about, the pounding heart, the sweating, feeling like you can't breathe. But then there's the other side, the cognitive side, which, let me tell you, can be just as terrifying. It's this weird feeling of being detached from your own body, this raw fear that you're losing control or going crazy, and that absolute overwhelming certainty that you are about to die. It's this mix of body and mind that creates the perfect storm.
Okay, so if the symptoms look so much like a heart attack, how does a doctor solve this medical mystery? Well, it's a really careful process, kind of like diagnostic detective work that goes way beyond just hooking you up to a machine. Right, so it's not about one single test. It's a process with 3 key steps. It all starts with the most powerful tool a doctor has, just listening to the patient's story. From there, they start looking for specific patterns in behavior. And finally, the doctor takes all that evidence and makes a careful clinical judgment. It's about seeing the whole person, not just the snapshot of them in crisis. And this really gets to the heart of it. Often the biggest clues, they're not found in a blood test or an EKG, they're found in the story. A doctor's most powerful tool is to just listen, without jumping in, without interrupting, letting someone explain what they've been going through. Not just during the attacks, but in all the time in between. So as that person is telling their story, clinicians are listening for 2 huge red flags that really point towards panic disorder. The first is something called anticipatory anxiety. That's that constant nagging fear of, when is the next one going to hit? The second is avoidance behaviors. This is when the fear actually starts to make a person's world smaller. You know, they might stop driving on the highway or avoid crowded places or always take the stairs. Anything to avoid a situation where they're afraid another attack might happen.
All right, so once there's a diagnosis, the story doesn't end there. Nope. In fact, that's where the most important part begins, the path to recovery. And you know what? The outlook is incredibly hopeful.
So here is the good news, and it is the most important thing to hear. Panic disorder is a real biological condition. It is not a character flaw. It is not something you can just snap out of. And because we understand it's a real medical issue, we have developed incredibly effective, evidence-based treatments. There is a clear path forward. The two main paths to getting better are therapy and meditation. The absolute gold standard for therapy is cognitive behavioral therapy, or CBT. Now, this isn't just about talking about your feelings. It actively teaches you how to spot and challenge those catastrophic thoughts that fuel the whole panic cycle. It also gives you practical tools like breathing techniques that can literally reset your nervous system in the moment. And alongside therapy, medications like SSRIs can be a huge help for long-term relief by helping to regulate your brain chemistry. And that brings us right back to where we started. That 31%. It's not just a statistic, is it? It's more like a road sign. Understanding that a third of these really scary episodes come from a psychiatric source helps doctors avoid a ton of unnecessary, expensive tests. And more importantly, it gets people to the right kind of help way faster. It turns all that confusion into a clear diagnosis. So in the end, even though a panic attack feels like your body is betraying you in the worst possible way, it's really just a faulty signal, a cross wire. And that kind of leaves us with a final thought to chew on. What if the real power isn't just in stopping the alarm, but in learning to recognize it for what it is, a false one, and knowing, deep down, that you have the tools to be the one to turn it off?